As Dr. Lewis Clark, I want to thank you for joining us on our neuropathy series journey. So today we're talking about inflammation and neuropathy. I have people ask me all the time about inflammation. Is inflammation bad or is it good? Well, it's good and it's necessary in the right confines, okay? So in an ideal environment, inflammation turns on when needed to heal and then turns off. Where it becomes a problem is where it doesn't turn off. Okay, and so that's what I want to talk to you about today. And I want to talk to you specifically about the role that inflammation can play in your neuropathy problem. So if you're a person that suffers with any type of neuropathy, whether it be in your feet, numbness, tingling, burning, pins and needles, coldness, or in your hands, you have problems with dexterity, dropping things, this video can help you understand one of the causes that maybe has not been addressed yet. So, and that's inflammation. Now, there are some causes for inflammation because inflammation is not the beginning, but the result of something that's happening inside your body causing damage. So I'm going to go through the top 4 reasons and causes for inflammation, besides the fact of injury. So injury is obviously, you can have a sprained ankle, you can drop something on your toe. Obviously, it's going to be painful, inflamed. That's normal. I'm excluding injuries, and I'm saying the top 4 reasons for inflammation are, number 1, diet. In particular, the SAD diet, which is Standard American Diet, which is incredibly processed, incredibly toxic, as well as low nutritious value. I'm talking about things that have chemicals in them to increase shelf life, that have chemicals in it to try to enhance the taste of dead or unhealthy or certainly unnutritious food. And I'm certainly talking about the amount of sugar that we take in, which I'll address later, and then also have to do with the lack of nutrients in our food. The second thing, not only do we have a problem with diet, but we also have a problem with stress. Stress can be a humongous increased inflammatory cause. And the reason for that is because of the stress hormones that are produced inside the body can be pro-inflammatory. And so with that said, we need to definitely say, hey, is stress a factor in why my neuropathy is worse? Give an example. I have patients that come in to see me that feel worse after they've had a stressful event in their neuropathy. Well, there's a sign right there to tell you that that's one of the factors in why you have the problem that you have, and it must be addressed and controlled in your body's ability to handle that in order for you to get over your neuropathy pain and situation. Now, the third thing we're going to talk about leading up to something here is we have what we will call toxins. Okay, and these toxins can be in the form of blood sugar, okay, which we just mentioned, which is a huge factor of inflammation, but it also could be a type of other things that we put in our bodies that can, or that our bodies get exposed to in our environment, as well as it could also be some type of chronic infection, whether it be a virus, a bacteria, or something else that is causing your immune system to have to react, and that causes inflammation. And all of these things here are going to lead to the fourth one, which is the big one, which is leaky gut syndrome, okay? All of these things are ultimately, when you get inflammation, you're going to get leaky gut. Now I'm going to help you hopefully understand leaky gut. In your intestinal tract, you have cells that butt up against each other called enterocytes. These cells have things on the top called villi, which is where you get your absorption that happens, where things are absorbed into the body, and they go through what's called a tight junction. So these cells are very close together, and they only allow through nutrients that have been completely broken down to pass through into the bloodstream, which is down here. This is where the bloodstream would be. So what happens in leaky gut is you begin to get inflammation and other things that happen that bust open these tight junctions, and you get a gaping hole that now allows things like toxins like the viruses and bacteria, as well as undigested food like proteins that have not been broken all the way down to amino acids, to then get into the bloodstream. And guess what's going to happen when it gets in the bloodstream? God has given you an amazing system to protect you from anything that's in the bloodstream that's not supposed to be there. It's called your immune system. So your immune system is going to begin to react to these things. And that's going to cause more inflammation. And then it's going to lead to some other things. So inflammation leads to leaky gut syndrome, which leads to food sensitivities. Food sensitivities, because now if you're getting gluten or casein or another type of protein that can't be broken down completely into your bloodstream, your immune system is going to tag that as foreign, and now every time it sees it, it's going to cause an immune response or immune reaction. By the way, in your gut is 75% of your immune system. Immune cells, 75% are in the gut. So we got inflammation leading to leaky gut. Now we've got food sensitivities, and then that's going to upregulate our immune system and lead to autoimmunities and autoimmune attacks. Okay, so what can be done about it? By the way, one of the most common tissues to get attacked by your immune system and an autoimmunity is your nervous system tissue. And there you go, more neuropathy, more damage. People come in to see me all the time. They say, "Doc, I don't have blood sugar problems. I haven't had chemotherapy. Why do I have this neuropathy?" It's possible you got an autoimmune problem. So that's something that must be determined. So how do we deal with these things? In our office, we must heal and seal. We must heal the underlying problems and get rid of the underlying problems and heal the damage, and then get the gut sealed back up so you don't continue to have things going into your bloodstream to upregulate your immune system and cause further damage. And if you do that, you got a really good chance to feel a lot better than you've ever felt. And I'm going to tell you the good news, neuropathy can be improved. But the bad news is, if you got any of these things going on right here that we just talked about, your drugs that you're taking will not work long term. They may cover the symptoms temporarily right now, but they won't forever. It will get worse. You'll need more drugs, and eventually they won't work at all. And they will never correct the underlying problem that's causing your neuropathy. That's what we try to do here. If we can help you do that, if you have any questions, contact our office, and we'll look forward to seeing you on our next video. Until then, live life well, and God bless.